Hello, this is Dr. Lewerenz at Longevity Health Institute. Thursday, the 25th of July. Beautiful day, actually. Humidity's gone. Hopefully you guys are enjoying summer as it flies by, right? So listen, I don't want to show you names here, but I want to impress upon you something we do here in our personalized functional medical practice daily, unfortunately. And we do it well, and it has to be done well. And it's super important, and you can't overlook this. And it seems so simple, but it's just so repetitive, and it's happening more and more and more, not just in this practice, not just in this city, this state, this country. It's everywhere. So you got to be watching this, and I cannot impress this upon you anymore. And this is why you got to share this message with others. So here's 4 cases today. Can't show you names, don't want to show you names, but I want to just impress upon you one thing. This is a case of non-ulcerative dyspepsia, seen a GI, had a scope, and has been dealing with chronic fatigue, inflammation, fibromyalgia, a 40-year-old, been with us for about 6 months or more, just got scoped, all common issues. New patient today, actually super cute little boy, 3 years old, family brought him in. Dad, a professional hockey player, has allergies, reactions, asthma, eczema, okay, commonality. A 65-year-old with autoimmune disease, Barrett's esophagus, low white blood count, common disorder. What do these all have in common? I'm getting there. Another one has inflammation, chronic pain, arthritis, hair loss. At one point couldn't tolerate thyroid and T3, armor thyroid, desiccated thyroids, had reactions to. What is all common in these cases? This is a 40-year-old, okay? Gut health, autoimmunity, allergies, diet, okay? All very, very, very common scenarios. So the point is, patients come in to see us. I always say they come in here from 8 to 80, literally, and they come in here with coughs and colds to cancer. They come in here with autoimmune disease. They come in here with fatigue, low libidos. They come in here, struggling with weight, thyroid issues, you name it, sex hormone issues, menopausal issues. And we treat all those. I always say this, patients come in here with symptoms and their goals, and we ask that, but we also have our goals, and our goals are to solve theirs, but also make them well and put them on a better quality of life, restorative pattern, and to make them well and to keep them well, a better immunity. And 99.9% of that starts at the gut. All of those cases, those autoimmune cases, eczema cases, allergy cases, Hashimoto autoimmune cases, intolerance to medications are all based on poor gut health. And each one of those cases are different on how we unravel that, whether it's, excuse me, with live blood analysis, with food allergy testing, nutrient levels, and coaching with their diet and gut elimination things, and building up and fixing the dysfunction in the lining in the gut you've heard me talk about, okay? New study just came out, actually just a month ago, that lupus, an autoimmune disease, has more than doubled in the last decade. Why is that? Why do you think that is in America? I'm going to tell you why. Yes, it's toxins and detoxification, but it also starts at the gut lining. We're seeing astronomical rates of autoimmune disease, including lupus, and we diagnose that here and find people here all the time with these types of conditions. And yes, we have special treatment for every autoimmune condition, but it starts at restoring gut health, talking about diet, talking about fixing the epithelial digestive lining, getting rid of SIBO, getting rid of leaky gut. That's where the fix is, and that's where you start to build immunity. One of the cases here had chronic low white leukopenia, low immunity, chronic infections, and then what did they have? They would get sick, fight, allergies, fight coughs and colds and bronchitis and the flu all winter, etc. Okay, and that starts and ends at the gut. You got to fix that digestive lining. Okay, that's your immune system. Another case here I mentioned briefly was somebody that when I brought up in her first initial few visits, she was very leery of using any T3, any Armour thyroid, any nature thyroid, etc. She had terrible reactions. She had anxiety and had palpitations and felt terrible on this new thyroid preparation when another doctor tried to switch her off her Synthroid. Okay, why does that happen? Because she can't assimilate it and break that down appropriately at the digestive lining. She didn't really have digestive symptoms, minor stuff. She didn't associate it. That other doctor didn't associate it. You fix the gut, you fix the lining, you absorb and assimilate medications even, medications, not just nutrients, medications even better, and now you have your fix. She's doing wonderfully. Actually, we kept her on Synthroid. We're still fixing her gut, but her gut's about 80-90% better, but now we're able to up her Synthroid, and she's still getting that T4, T3 conversion, which is fine on low dose Synthroid or levothyroxine, okay, because her enzyme, that 5' deodenase enzyme that takes T4 to T3 for her is still working, but it started at fixing the gut. So you can tell, sorry to be so repetitive, but the commonality here is no matter what you come in with, and yes, we work on many things and hormonal balance, but in a functional, whole, metabolic, personalized medical approach, you always are working on diet and gut health. And it can be fixed. It takes some intention, it takes some effort. It doesn't happen overnight. Most people don't develop these things overnight, but it does happen, it does resolve, and it can be fixed. We're happy to guide you with that. Now, here at Longevity Health Institute, we have a few locations. We also do phone consults around the country, have patients call in and come in from other states. We can guide you with the best approach, sometimes connect you with other practitioners in the country. But also, my practitioners here and myself are happy to see you here. We always use the best medical grade pharmaceutical type nutrients. You can actually get them on our website through our website through our distributor called Carewell. You can actually log in there and order the best supplements and products, and we'll give you the best guidance with that. And then this whole functional, personalized approach can work for you. Can't piecemeal this stuff. It has to be a whole system. You work just like engineering, like a car, actually a little bit more sophisticated, but it's the same thing. It can't just be a one-size-fits-all approach. Medicine doesn't work that way, I promise you. So anyway, take this to heart, share with others. Hopefully we can help you, or you can share this with others to get some help. This is Dr. Lewerenz, Longevity Health Institute. Keep it well and get better. Be well, Dr. Lewerenz.